Let's look at the gallbladder channel and its 44 acupuncture points. Yes, the third longest meridian on the body. I am going to first look at the gallbladder function according to Chinese medicine, which is the perfect partner to the liver, channel, and organ. Then we're going to look at the meridian pathway and function, and each acupuncture point's location, function, and of course, some of my clinical pearls. Are you ready? Let's go. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's rock it. The gallbladder organ, according to Chinese medicine, is the yang organ paired with the yin liver organ. And they are such a good pair together because the gallbladder reinforces the liver function. Liver function is to move qi, and gallbladder can contribute to that. And we'll see some of the points that are really good to move qi, specifically during pregnancy when we have to be more gentle with our treatment and, of course, keep the patients and the baby safe. The number one function of the gallbladder is to protect the joints, the ligaments, and the tendons, all the sinews. So if there's any issue with those, we have to look at the gallbladder. And not only that, but we probably would use gallbladder point as well in order to treat the patients that have ligament, tendon, or joints issues. The other function of the gallbladder is to store bile, and that makes the gallbladder also an extraordinary organ. So it's part of the yang in the Zang organ, but also of the extra organ because it has this function to store bile. And in Chinese medicine, the bile is a very much golden essence kind of fluid that helps keeps us young. So the question I get a lot from students or even patients is, well, what happened if I had my gallbladder removed? Because this happens a lot. We see a lot of patients that have their gallbladder removed. Well, the physical organ is no longer there, but the energetic of the meridian and the organ, the spirit, the emotion is still part of the person. However, that meridian itself or organ would be a bit weaker, and we need to support it even more because we're missing the physical part of it. Does that make sense? So the gallbladder is also related to self-esteem, decision-making, and courage. So when someone has a hard time making decisions, this is so my husband, we'll go somewhere for dinner and there's like 5 parking spots. That is not a good thing for my husband because he'll go, oh, should I park in this one? No, that one. No, that one. And I'm like, just pick a spot. So if people have a hard time making decisions that are really small decisions, I'm not talking about a life decision, but something like you go out to dinner and then they look at the menu. Oh, should I have the chicken? Should I have the fish? I don't know. And then they keep humming and humming about which one to have. That is a weaker gallbladder. Yes? Okay. So the gallbladder is also part of self-esteem. So when I have patients that have low self-esteem, can't make decisions, I really truly want to protect and preserve the gallbladder and support the gallbladder to the best of my ability. And we will see there are perfect points to do that. So the gallbladder is great to reinforce the liver, but because of where it goes, because it goes around the ear, for example, it is a perfect meridian to support the liver when it comes to liver yang rising and a lot of things that happens in the head, like headaches, temporal headaches, or tinnitus that is high pitch. That is a liver yang rising issue, but there's no liver points on the head. However, there are gallbladder points that are going to address those issues. Like I said, perfect partner to the liver. Let's look at the gallbladder channel pathway. Before we do so, I want to remind us that the gallbladder meridian is a yang meridian. It is a Shao Yang meridian. The Shao Yang means lesser yang because it's the least yang of all yang meridian. The first ones are the Tai Yang, then the Yang Min, then the Shao Yang. Now, the Shao Yang meridian are the Sanjiao and the gallbladder. So they pair very well together when we want to treat patients because they're both Shao Yang meridian. The Sanjiao is a hand one and the gallbladder is a foot Shao Yang meridian. It is at its peak between 11 p.m. and 1 a.m. Now, a lot of my patients go to bed around midnight. And in Chinese medicine, this is the time where we should be sleeping to recover from the day's activities, right? And stress. So when people go to bed around midnight, it actually depletes the gallbladder. Those patients have difficulty in making decision or self-esteem issue or self-doubt. So it correlates so well. And I love that about learning Chinese medicine and understanding how those clues give us little things that we can look into a little bit deeper to see, okay, this problem with the gallbladder, how do I address that? And what does it lead to? Does that make sense? So that's for the gallbladder channel itself. Now, if you look at the pathway, what I think is fantastic about this channel, and confusing too, because when I was in school, I thought, oh my God, this is such a hard one to remember, because it was zigzagging a lot, right? Zigzagging back and forth on the head, zigzagging along the ribs, even all the way down. It's like it's not sure if it wants to be in the front or in the back, in the front or in the back. It cannot make its decision, right? Here it goes. It does not know if it wants to be in the front or in the back. So the Shao Yang is always in between the yin and the yang. It's kind of revolving door. And often we say the Shao Yang channels are a revolving door between the yin and the yang, because the next level after that, when you go deeper within the meridian, is the Tai-yin level. And the Tai-yin is spleen and lung. If you haven't seen my meridian layers video yet, I'll have the link below this one so you can check it out, so to understand the levels and the layers of the meridian. But the gallbladder meridian is a revolving door between the yang and the yin level. So having said that, the zigzagging, let's look at the pathway of this crazy back and forth kind of meridian. The gallbladder meridian starts at gallbladder 1 at the outer canthus, and will go down to the ear, up to the forehead, back down behind the ear, back to the forehead, behind the head, all the way down to the supraclavicular fossa. That same branch here is going to continue on the ribs area, zigzagging down all the way down to the inguinal region, to the glutes, all along the lateral side of the leg, all along the lateral side of the lower leg, and finishes at the fourth toe. The first branch that starts behind the ear emerges in front of the ear, goes to the outer canthus. The second branch starts at the outer canthus, goes to meet stomach 5 on the cheek, along the side of the neck to the supraclavicular fossa, enters the body, connects to the liver and gallbladder organs, and then will go down to the abdominal region to the external genitalia area, wraps around it, and meets the outside branch at the inguinal region. And the last branch starts from gallbladder 41 at the foot and will finish at the first big toe to meet the liver. The function of the gallbladder channel as a whole is obviously to treat anything that's happening along the channel, but also because it goes on the head, headaches, eye issue, ear issue, neck issue, as well as dizziness and anything that's happening obviously on the face and the eyes and the ears. It's also going to be helping anything with ligament, joints, and tendons, just like the organ itself in Chinese medicine, but also anything that has to do with marrow and essence, as well as the reproductive system, specifically because it wraps around the external genitalia, right? So we could see all the function kind of making sense in the end. Yes? Okay, so now let's look at each point's function and location. GB1 is half-a-tsun lateral to the outer canthus. GB2 is interior to the ear tragus. GB3 is directly above stomach 7 on the upper border of the zygomatic arch. GB4, 5, 6 are all located on the temporal area on the curve connecting stomach 8 and gallbladder 7. GB7 is interior and superior to the auricle at the level of the ear apex. GB8 is 1.5 tsun directly above the ear apex. GB9 is half a tsun posterior to GB8. GB10 and 11 are all within the hairline and within the curve connecting GB9 and GB12. GB12 is inferior and posterior to the mastoid process. GB13 is 3 tsun lateral to the midline and half a tsun within the anterior hairline. GB14 is 1 tsun directly above the eyebrow midpoint. GB15 all the way to GB18 are all located at 2.25 tsun lateral to the midline. GB15 is half a tune within the anterior hairline, 16 is 1.5 tune, 17 is 2.5 tune, and GB18 is 4 tune within the anterior hairline. GB19 is 2.25 tune lateral to the midline at the level of the occipital protuberance. GB20 is half a tune within the anterior hairline, halfway between the sternocleidomastoid and trapezius muscles. Gallbladder 1 is such a good point to be part of a protocol for Bell's palsy. I see a lot of patients with Bell's palsy. It's very common, and acupuncture is fantastic when it comes to it because if we can catch it right at the beginning, we can help patients get full facial activity 100% back. If you haven't seen my Bell's palsy treatment video yet, I'll have it linked below this one because it is very useful in clinical practice, so I want to make sure you don't miss out on it, right? So gallbladder 1 is a perfect one to be part of that protocol or any kind of facial paralysis. For example, after a stroke. This is a really good point as well. So when it comes to that, we can also use it for migraines, specifically combined with stomach ache, because stomach ache and gallbladder 1 for migraines is a perfect combo. Gallbladder 2, small intestine 19, and Sanjiao 21 are all located in the same area, so they all do the same thing, which is pretty much addressing tinnitus or ear ringing, TMJ, jaw issue, or trigeminal neuralgia. So you can pick which one you think is best suited for the patients depending on what's happening with them. Are they more gallbladder related? Is the pattern more of a problem with small intestine, gallbladder, or Sanjiao? You can pick. You don't have to use all 3 points. They all do the same thing, and that's why I use the same graphic for all 3. Gallbladder 3 for me is very useful for trigeminal neuralgia with stomach 7. Stomach 7 is below the zygomatic arch and gallbladder 3 is directly above it. And so 2 together are really a good combo when it comes to trigeminal neuralgia. And then you can add up stomach 8 to it, stomach 6, and large intestine 4. Perfect combo. Now you can also use gallbladder 3 for facial paralysis like Bell's palsy and post-stroke, as well as use it for tinnitus. But if you're going to differentiate, I would use gallbladder 1 more for migraine and Bell's palsy. I would use 2 more for tinnitus, and I would use 3 more for trigeminal neuralgia with stomach 7. But of course, all of them can be used as part of Bell's palsy or post-strokes. See, this is how we differentiate. Make sense? Gallbladder 4, 5, 6, 7 that are all located along the edge of the temporal area are going to have similar function. They're all going to help with temporal headache, migraine, but also convulsion, tinnitus, and dizziness or vertigo. As I said, gallbladder 5 and 6 are going to be similar than 4 with convulsion, migraine, tinnitus, dizziness, vertigo. So how do you pick which one? Well, sometimes you need more than one, and sometimes you palpate. Palpate gallbladder 4, 5, 6, 7, and go, ooh, this one is the most tender one. It's 6. Then use 6. Always palpate to see which one is most tender when they're so similar and very close to each other. Yes? Okay. When it comes to gallbladder 7, it's again similar, but on top of it, we can use it for lock jaw because of where it's located. I would also obviously combine this with stomach 7, maybe stomach 6, and then gallbladder 3, gallbladder 7. Like if there was a locked jaw, we want to use all the points in that area. Now, when it comes to gallbladder 8, one of the things that I learned in school that a lot of us did is that it is a great point for hangover. So when people have tendency to have too much to drink, the next day they feel like migraine-y or headachy and nauseated. This is a good point to have. Obviously, not drinking the night before is the solution. But this is a good point to have for acute hangover for the next morning. It does the same as the other previous point for tinnitus and migraine and temporal headaches. We can use, again, the ones that are more sensitive. Gallbladder 9, same thing as the ones before with the convulsion, the tinnitus, the temporal headache, the migraine. However, one of the things that gallbladder 9 also address is phobias. So it really calms people that have phobias like germophobes or anything that really impairs their life. And what's interesting is if you combine gallbladder 9, which is great for phobia, and kidney 4, that is the perfect combo for phobia. And if you haven't seen my video on the kidney channel and the kidney points, I literally talk about kidney 4 being the best point when it comes for phobia. Well, reinforce it with gallbladder 9 if that is what your treatment is aiming at. Gallbladder 10 and 11 both, again, have similar function because of where they're located behind the ear. So tinnitus, ear pain, neck pain because of where they're located close to the SEM or sternocleidomastoid muscle. And they can address temporal headaches, specifically if it's coming from the SEM and there's a lot of tension in that area. And again, you can needle both of them or pick the one that is most tender. In clinical practice, using gallbladder 12 for neck pain or tinnitus or temporal headache or tension in that area is fantastic. However, one of the things that I love about gallbladder 12, it's great for insomnia. It is very close to Anmian, which is obviously an extra point that we use that is very specific for insomnia. But gallbladder 12 is also really good. So I can also show patients to acupressure this point before they go to bed with this and heart 7. It's also a very good point to decrease high blood pressure. And gallbladder 20 also does this. And you can see how close they are to each other. And those points are really good to bring the blood pressure down. Of course, again, you want to address the pattern of the patient that has high blood pressure, but those are great points to use in the clinical practice. Gallbladder 13 is not used a lot in clinical practice. Have you used it often? Obviously, when I palpate and it is tender, it's a great point to use. You can use it for Bell's palsy or post-stroke because it extinguishes liver wind. So great for if there's headaches or migraine in that area as well, specifically with stomach 8, which is one of the best points when there's migraine combined with long 7. Remember, long 7 is the commander point of the head and neck. So if there is a lot of migraine due to neck tension or on the side of the head, this is also a point we want to put with LI4, large intestine 4, because that's the headache point, plus a point like gallbladder 13 if there is a migraine in that area. It can also be used for vertigo or dizziness. You can also use it for insomnia where people worry a lot. So because they worry a lot, they cannot fall asleep. You could use gallbladder 13 combined with spleen 5. Spleen 5 is the best point when we worry or overthink too much. And then you can add up points to decrease the anxiety, like pericardium 6, REM 17, and heart 7 to sleep. See, this is how you can do a quick treatment if you're not sure what your diagnosis is, because sometimes it takes time to figure out the diagnosis. And it's okay to pick the right point or select the right point for the patient at this time to start that way and eventually build on it as you get more information or you feel more confident about your diagnosis. I love gallbladder 14 and I use it all the time because it's on the forehead. It's great if there is obviously headache that is frontal, which a frontal headache is a Yang-Ming headache, which often is due to stomach issue, but it affects the gallbladder as well. Because of where it's located, upper sinuses pain or upper sinuses that are affected, this is a great point to open the sinuses, right? I love to use it for that. And we can use it for Bell's palsy or post-stroke because of its location as well. It's a point we can use for a lot of lacrimation, which means a lot of tearing or tears or water coming out of the eyes. That is something that happens often with the gallbladder meridian and people that have aversion to wind. Gallbladder 15 can be used for nasal issue like rhinitis, stuffy nose, and you can combine it again with gallbladder 14 if there's sinuses issue and large intestine 20 to open the nose. Gallbladder 16, 17, and 18, again, very similar function. And you can palpate until you found the tender one to use the one that you think is best. Very good for dizziness, vertigo, but also headaches in that area and stuffy nose. Gallbladder 19 can be used again for vertigo, tinnitus, neck pain, because of course where it's located, occipital headache, and a protocol for epilepsy. Now, when it comes to epilepsy, we have a lot of points that are used for that purpose. And we have to think that we are trying to prevent attacks. We're not going to cure epilepsy, but we're going to prevent the attack and make sure that the body is calm and there's less attack happening for this patient. Does that make sense? So gallbladder 19 can be used as part of a protocol for epilepsy and usually specifically combined with due meridian point or governing vessel meridian point. I always call it the due meridian. I like to use the Chinese word when it comes to the du mai or the ren mai, etc. Right? The 8 vessels. I love the 8 vessels. Don't you love the 8 vessels? Fantastic channels to use in clinical practice. Again, I have a video on those. If you haven't seen it yet, I'll put the link below this one so you could check it out as well. Gallbladder 20 is used a lot in clinical practice. Now, when we use this point, the patient is face down on the table, right? And I was taught in TCM school that we always needle the head last, no matter if we're supine or prone, right? Face up, face down, lateral, whatever the position, we always finish with the head because the head is so young, so powerful, and the points on the head are so strong that we don't want to induce too much energy so fast, so quick, because it could give people dizziness or even fainting. And I've had a lot of students or practitioners saying to me, I don't want to needle gallbladder 20 because I've seen patients fainting due to this point. I think that if we needle the body first and then go and do the head, or like gallbladder 20, of course, that would mitigate the problem. And I have to say, I've always done it that way in clinical practice, and I've never had anybody passing out. Now, we also have to remember that some patients that faint easily could be the fact that they haven't eaten in 6 or 7 hours before they come for treatment, and that's a big no-no as well, right? So we have to always make sure we tell patients that they should eat at least a couple of hours before, but not overeat neither. There's that balance in between the two, right? So, but make sure that you needle the head last, because for me, it has worked very well since 2003 in practice, and I've never had anybody fainting or getting really dizzy when I needle the back of the head or gallbladder 20. Okay, so gallbladder 20 is a very good point when there's cold, flus, because it expels external wind, but also for internal wind. So if there is a lot of tremors and tics and twitches, this is a good point to add to your protocol. It is used, of course, for occipital headache because of where it's located, neck pain, but also to reduce or bring down the high blood pressure. Like we talked about earlier, you can combine points, but gallbladder 20 and gallbladder 12 together, which are very close together if you think about it, reduce high blood pressure. GB21 is on the highest point of the shoulder, halfway between the acromion and the spinous process of due 14. Let me show you how I needle gallbladder 21. I think a lot of people really worry about needling it because the ear apex is below, and that makes sense. However, if we grab the muscle, the trapezius, and we needle towards the back of the body, I was taught to needle towards the back in a way that was oblique or transverse, depending how big the person or the patient is. I hope the needling of this really, truly helps you. GB22 is tweetsune directly below the axillary midline on the 4th intercostal space. GB23 is 1 sune anterior to GB22, still on the 4th intercostal space. GB25 is located at the free end of the 12 floating rib. GB26 is below liver 13, tweetsune above the navel at the free end of the 11th rib. GB27 is tweetsune directly below the navel on the border of the anterior superior iliac spine. And GB28 is on the border of the anterior superior iliac spine as well, half a tsune inferior and anterior to GB27. We made it to gallbladder 21, a point that we use a lot in clinical practice, a point that people feel really can be challenging because of the needling part of it. I think this is why doing cadaver lab or having really strong palpating ability of the muscle makes you understand where the long apex is located, so there is no risk of pneumothorax if you make sure that you needle the muscle, you needle the traps, and not straight down towards the apex, right? But if you needle towards the back, in the traps area, it is quite safe. However, because it's a powerful point of where it's located, it is counterindicated during pregnancy unless it's needed at the end to help with labor induction. Now, labor induction is a very specific thing that we may need or not need. It's not something we want to do with everybody, but if it's needed, Gallbladder 21 is part of the protocol, and I have a whole pregnancy course that explains this in detail safely, so you can check it out. If you haven't checked it out, I'll have that link below this video as well for you. However, I love to use Gallbladder 21 because it's such a trigger point to help release all that tension in the shoulders that comes from people sitting at their desk all day long, or the stress that accumulates in the shoulder and upper back, right? This is such a powerful point when it comes to pain where it's located. It's also a really good point to help when there's lack of breast milk. So labor induction, lack of breast milk, but not during pregnancy. So this is a woman's point a little bit, but also a musculoskeletal point. Fantastic. You gotta love Gallbladder 21. Gallbladder 22 and Gallbladder 23, very similar function. Not used a lot in clinical practice because of where they're located. It's usually for cough or asthma or pain in the ribs. However, I love to use spleen 21, which is a little bit lower, and it's such a great point for fibromyalgia that I don't use those 2 points very often unless there's pain right in that area. Are you enjoying my graphics so far? Well, they are all from my book, Acupoint Made Easy, which the feedback on it has been amazing. You can either get the hard copy, which ships all over the world, or you can get the digital version, which has video links and can be downloaded on any devices. Like I said, the feedback from students and practitioners has been amazing. So if you need your copy because you haven't had it, I'll have the link below this video. Now let's get back to the beautiful Gallbladder Zigzag Awesome Meridian. Gallbladder 24 is the front move point of the gallbladder, which makes it so powerful and useful in practice. Now, all front move points connect to the respective organs, right? So this connects to the gallbladder. And remember, the gallbladder has decision-making issue or difficulty in self-doubt, self-esteem. Well, Gallbladder 24 is the best point for lack of direction in life. This is such a great, powerful point to help patients when they feel stuck, when they feel like they don't know what is their purpose, what's the direction of their life. If you haven't seen my video on the 5 spirits according to Chinese medicine, I talk exactly about this and how Gallbladder 24 is fantastic to help patients when there's lack of direction. Again, I'll have this video below for you to check out if you haven't seen it yet. I have so many videos. Can you believe it? I have so many videos on YouTube. I hope they benefit you on a regular basis. And I'm so happy that so many people tell me all the time that this is so useful to them because I love to teach, as you know. Being the front move point, it also addresses issue of the gallbladder like vomiting, nausea due to gallbladder issue, gallbladder pain, gallbladder stone that are creating pain. It's not going to eliminate the stone, but at least it's going to manage the pain until we can figure out what the treatment plan is for that patient. It can be used also as part of a protocol for hepatitis because it's the partner of the liver, right? It really helps the liver, or acid reflux. So really a digestive issue that is coming from a physical gallbladder problem. Yes? Awesome. Gallbladder 25 is also a front move point, but this time of the kidney. So it is more located almost in the back, right? It's closer towards the kidney organ, and it is the front move point of the kidney. So we can use it for kidney stone pain. Again, it's only for the pain, but also low back pain and stiffness of the back pain. So remember how we said that the gallbladder is a Shao Yang meridian, and Shao Yang meridian, the other one is Sanjiao. And the Sanjiao has this ability to clear damp and heat. Well, the gallbladder, the other Shao Yang, also has a lot of function, and a lot of points will have function to clear damp and heat because those two meridians do get affected by dampness and heat. So Gallbladder 26 is a really good point to eliminate damp heat, specifically affecting the external genitalia, because we know that the meridian pathway wraps around that area. So we have to address those issues. Make sense? So excess vaginal discharge, specifically, that is a lot of discharge that is yellowish, not white. White is more damp cold. Damp heat would be more yellowish excess vaginal discharge. or a herpes outbreak in male or female. It can also be used to reinforce the dai or the dai vessel, which is the only one that is horizontal and keeps all the meridian in place and has tendency to really address issue of the pelvic floor. So if there's uterus prolapse or anything affecting the pelvic floor that is heat and damp, we want to use gallbladder 26. Gallbladder 27 and 28 are both very close to each other. They can be used for inguinal hernia. Now, when I've had patients with inguinal hernia, let's say on the left side, I usually needle those points on the right side. It works really well, and that way I don't touch the area that is really painful. And of course, we can use distal point to add up to the protocol, but it works quite well in helping the patients with the pain. Now, gallbladder 27 and 28, similar to 26, they are part of the dai meridian, the dai, and so they do similar things, which is the external genitalia issue with excess damp heat, and we can use those points as well. I think 26 is easier to use because it is an easier point to locate and to needle on patients. GB29 is halfway between the ASIS, or anterior superior iliac spine, and the prominence of the greater trochanter. GB30 is located between the sacral hiatus and the greater trochanter. It is 2/3 to the medial line that really connect those two entities. GB31 is 7 soon above the popliteal crease on the lateral side of the thigh, and often to locate it, we can just have the person landing gently, normally, the middle finger on the iliotibial band, and that's where usually gallbladder 31 is located. Gallbladder 32 is 5 soon above the popliteal crease on the lateral side of the thigh. GB33 is 3 soon above GB34, lateral to the knee joints, above the external epicondyle of the femur. GB34 is interior and inferior to the head of the fibula. Now, this is really easy because you can feel the head of the fibula and you can feel also the tibia head as well, and it's between the two. Needling gallbladder 34 is so efficient, and I just wanted to show you how I do that because it's fun to needle, right? We all love it. Years ago, I got bursitis on my hip, so greater trochanter area, so painful. I had this massive bursitis. I was running a marathon and it just inflamed everything. And so gallbladder 29 was the local point that helped relieve the pain so quickly. It's great to have distal point with it, but boy, I love that point. It was painful, but it helped so much. So think of this point as a very local point with pain in the area or IT band stiffness, that is pain that radiates maybe from the back and comes to the hip or the side of the greater trochanter. For older people, this is where they have hip issues or arthritis. That again is a fantastic point to use for that. And when it comes to gallbladder 30, it's the same thing. It's very local. It's musculoskeletal related with sciatica and anything that's affecting the lower part of the body when there is a lot of pain, musculoskeletal and nerve pain as well. Gallbladder 31, 32, and 33 can all be used locally. Again, musculoskeletal related, IT band that is painful, pain in the knees, pain in the thigh, very much local. So I wanted to say that gallbladder 29, 30, 31, 32, 33 can all address B syndrome. B syndrome is really anything that creates pain, specifically with pathogens like damp, like heat, like cold. So arthritis is a kind of B syndrome because it gets worse with damp weather or cold or hot, depending what kind of arthritis and B syndrome that person is experiencing. Gallbladder 34 is the Superman of all gallbladder points. It is such a fantastic point. I mean, I think I use it on 90% of all my patients. First of all, it is the confluent point of all sinews, ligament, tendons, and joints. So if there's anything happening to those entities, we have to use gallbladder 34. Carpal tunnel syndrome, gallbladder 34. Knee issue, gallbladder 34. Anything that's happening to the joints, ligament, tendons, we have to use this point. It is fantastic. Second, it is a Rossi point, and all Rossi points around the knee or the elbow are going to clear pathogens, specifically heat, specifically at the elbow, and at the knee, damp and heat. So those are really good points we can use, very powerful. And the third one, gallbladder 34, is a lower Rossi point, which means all lower Rossi point address issue of the yang organ pertaining to the meridian. So gallbladder 34 is the lower Rossi point of the gallbladder. Does that make sense? So it really reinforces the function of the gallbladder on top of it. So that makes it a powerful point. It is great to use when there is any damp heat in the body. So external genitalia damp heat, or a bladder infection, a urinary tract infection, anything that's affecting a damp heat in the lower jiao, I am going to use gallbladder 34. It is so good, so powerful. And during pregnancy, it's a great point to relax the body, relax the joints, the ligament, the tendons, and move qi gently. So during pregnancy, I can use gallbladder 34 to help relieve the pain of the hips, the pain that's coming from the heaviness of the baby pressing down, right? Or anything happening with maybe gallbladder during pregnancy, or pain in the gallbladder, or nausea. It's a great point to add to your protocol for morning sickness. So I love to use that point for pregnancy in general because it is safe and it helps a lot. It is also, like I said, a point that relaxes, right? So for shoulder tension, neck pain, for headaches affecting the temporal area, we have to use gallbladder 34 as part of our protocol. Makes sense, right? Specifically gallbladder 21 with gallbladder 34, oh, relax the shoulder, all good. And the last part is, remember that gallbladder is about decision making? Well, gallbladder 34 is the best point when there is decision-making issue and self-esteem decision-making issue that is affecting your patients. It really relaxes them, make them feel unstuck so they can make that decision. Isn't it like the best point ever? Yeah, hello, woo! Gallbladder 34 rocks! GB39 is 3 tsun above the lateral malleolus on the posterior border of the fibula. And GB38 is 4 tsun above the lateral malleolus, still on the interior border of the fibula. GB37 is 5 tsun above the lateral malleolus. GB36 is 7 tsun above the lateral malleolus, but on the anterior border of the fibula. GB35 is 7 tsun above the lateral malleolus on the posterior border of the fibula. And GB44 is on the lateral side of the fourth toe, 0.1 tsun from the base of the corner of the nail. GB43 is between the fourth and fifth toe, proximal to the web margin. GB42 is between the fourth and fifth metatarsal bone, lateral to the extensor digiti minimi, 1 tsun from the web margin. GB41 is distal to the fourth and fifth metatarsal bones, lateral to the extensor digiti minimi. GB40 is in the depression anterior and inferior to the lateral malleolus on the lateral side of the extensor digitorium longus. Gallbladder 35 is a Shicklef point of the yang wei vessels. When it comes to the Shicklef point, we have the 12 main meridian Shicklef points, plus we have the yin wei, yang wei, yin chao, yang chao Shicklef points. So they are very specifically used in clinical practice to the yang wei in this instance, which is really good for pain on the leg, on the chest, or all along the yang wei channel. Does that make sense? So that's why we use gallbladder 35 to reinforce the pain that's affecting the yang wei channel, which is very close to the gallbladder channel, by the way. So they're very much related. You can use it for anxiety, but it's not the best point, so I wouldn't bother. However, I like to use stomach 40 with gallbladder 35 when there are recurring nightmares. One of my teachers had taught me that combination years ago, and it works fantastic when people have a lot of recurring nightmares, specifically if you use Heart 7 and calming mind point for the insomnia, which is affected by the nightmares, of course. Stomach 40, gallbladder 35, really good. Great combo, eh? Woo! Gallbladder 36 is also a Shicklef point, but of its own pertaining organ, the gallbladder. So it's great for gallbladder stone pain or gallbladder pain or rib pain or anything that's affecting the gallbladder organ. I don't use it that much because I use usually other points for that, but as a distal point, it's pretty powerful as well. GB37 is the luau connecting point from the gallbladder to the liver. So of course, the liver opens into the eyes. And so gallbladder 37 is going to address eyes issue like night blindness, blurred vision, red eyes, painful eyes. It's also good for breast distension, but it's not the best point, so I'm not going to bother. Remember gallbladder 37 more for an eye issue point because it's the luau connecting point and it connects to the liver. Gallbladder 38 is the Jing River point. So now we're starting to look at the Shu transporting point, right? And I do have a video on the Shu transporting point. People ask me that all the time. It'll be in the link below because it's so useful in clinical practice and it's not always easy to understand how to use the 5 Shu transporting point in clinic. So gallbladder 38 is the Jing River point of the gallbladder. And as such, it's really, really useful and powerful to regulate the Shao Yang syndrome. And what is Shao Yang syndrome? Alternating chills and fever. That is the perfect point. So it's used for acute when there is a lot of alternative chills and fever, right? That's revolving door between cold and hot, back and forth. That is a fantastic point. It can be used for leg pain and rib pain and migraine, chest pain. So a lot of pain along the meridian as well. But it's also really good to calm the burst of anger that comes out when liver yang rises, right? So that really is going to calm it down. Liver 2 is the best point to bring liver yang down when there's that burst of anger and rage. You can add gallbladder 38 to reinforce and support your liver 2. Gallbladder 39. I love to use gallbladder 39 in clinical practice, and I think sometimes we forget about it because it's the inferential point of the marrow. So if there's bone issue, the inferential point of the bone is bladder 11. I would combine bladder 11 with gallbladder 39 because, of course, the marrow is within the bone, right? So this is a really good point when there is issue with bones, like osteoporosis, or someone has broken bones and has issues. That is really a good point to add. And yes, it can be used for tendons, joints, ligament to reinforce gallbladder 34 function as well. GB40 is the Yuan source point. Yuan source points really connect to the source. So if there is pain along the meridian that has been there for a long time, maybe on the side like migraine or rib pain or leg pain that has been there for a long time, chronic, you have to put GB40 because it's really the Yuan source point of the gallbladder. And because of that, it's very good for alternating chills and fever, Shao Yang syndrome, right? Would you use gallbladder 38 versus gallbladder 40 for Shao Yang syndrome? I think I would pick GB40 over 38, but if that was your full treatment, then put both. Huh? That's how it works, right? Depending on what your treatment is about, what's the aim of each treatment. Gallbladder 41 is a shoestring point, which is great, but what I love to use it in clinical practice is that it is also the confluent point of the dye vessel or the dye mai. And remember, we said the dye vessel is the one that is horizontal and is wrapping all the meridians together, keeping them in place. And it's related to the pelvic floor. I love to combine the two Shao Yang meridian opposite points, Sanjiao 5, which is the confluent point of the Yang Wei vessel, and gallbladder 41, which is the confluent point of the dye vessel, together when there is pelvic floor issues, specifically when there's pain. For example, during pregnancy. At the end of pregnancy, to relax the pelvic floor, those 2 points are safe and they're great to relax the pelvic floor and help with pain. Sanjiao 5, gallbladder 41, perfect combo. Now, those 2 points can also be used together for damp heat in the lower jiao, urinary tract infection, a bladder infection, a genital outbreak of any kind like herpes, or anything that's happening with the external genitalia that creates damp and heat. Those 2 points together work really, really well because the dye vessel is in charge of eliminating damp and heat in the pelvic floor. Gallbladder 41 also connects to the eye as a distal point for a lot of tearing or lacrimation, which means a lot of water coming from the eyes, and also eye pain. This point as a distal point, part of the protocol for mastitis, works really well, but you need more points. That won't be enough if you just use that one. So gallbladder 41, lots of functions. It is a fantastic point. Gallbladder 42 is going to be a distal point when there is migraine or outside of the eye, lateral side pain, breast pain, or ear ringing. I don't think I use that point a lot because there are better points, more powerful point than this one. But if it was tender, then yeah, you can needle it. Gallbladder 43 is a yin spring point, and yin spring point clear heat. So this is a really good one to clear heat, specifically to relieve pain as a distal point away from the head of all the things that can happen, like vertigo, migraine, tinnitus, temporal headache, swelling of the cheeks, breast pain, all along the meridian, but mostly on the head, because this is a distal point to clear the heat and clear the pain. This is a fantastic point. Can you believe it? This is the last point, 44 points. Wow. This is a Jingwell point. As Jingwell point, they all do the same thing, which can be used for fever and fainting. But Gallbladder 44 has other functions that I like to use it for. Number one, it's great for dream disturbed sleep. So when we talked about nightmares earlier, that usually disturbs the sleep, right? You can have dream disturbed sleeps that are not nightmares, but if there's a nightmare, we said stomach 40 and gallbladder 35 is a great combo. You could also add up gallbladder 44 if the person has a lot of excess heat. That's how the dream disturbed sleep happen. If they're deficient and they don't have excess heat, I would not use that point. It's also used for heartburn due to overeating. Of course, we're trying not to overeat, but if that's the case, you can use it to clear the heat that creates the heartburn due to overeating, which probably overstrained the gallbladder organ, and that's why we have the heartburn due to overeating. Wow, I can't believe we did 44 acupuncture points. That was a lot, right? When you look at those points, try to differentiate them. If I think about it, I'm like, okay, gallbladder 2, great for tinnitus because of its location, right? You can go gallbladder 8 for hangovers. That is the distinction. Gallbladder 9 is great for fear and phobia. 12 and 20, great to bring the blood pressure down. 21, contraindicated during pregnancy, but great when it comes to musculoskeletal issue. Gallbladder 24, great for lack of direction. It's the front move point of the gallbladder. Gallbladder 25 is the front move point of the kidney. So great for kidney stones and low back pain. See, this is how we try to differentiate them. Gallbladder 26, great because it's on the diaphragm area for damp heat in the lower jiao, specifically around the external genitalia. Gallbladder 34, the influential point of the joints, ligaments, and tendons. Gallbladder 35, the chi cleft point of the Yang Wei channel, right? Remember all those little distinctions is so key to understand and how to treat patients in a clinical practice, or if you're a student, to pass exam. Gallbladder 40, great for Shao Yang syndrome. Gallbladder 41, fantastic to combine with Sanjiao 5 in order to clear the damp and heat in the pelvic floor area. So good, right? Gallbladder 43, great to clear heat, specifically anything happening on the head. And gallbladder 44 is the Jingwell point, so we can use it for dream disturbed sleep. Yes, there are 14 meridians on the body that have points. And if you haven't seen all the other channels, points, function, and location like this video, check out the playlist here and watch all the other ones because they'll be so useful. Doesn't matter if you're a student or practitioner, review and understanding how to use those in clinical practice is key to helping our patients feel better and reach their health goals. And no matter what, keep rocking it using TCM, and I'll see you in the next video.